Doctor, I'm worried I might have HIV. I can't stop thinking about it, and it's affecting my daily life.
Tell me, John, what's causing you to worry? It's important to share everything that's on your mind.
John nervously tapped his foot in the sterile environment of Dr. Smith's office. The white walls and the faint smell of antiseptic only heightened his anxiety. He clutched a crumpled tissue in his hand, his heart pounding in his chest. The fear of the unknown was almost paralyzing.
I've been feeling really tired lately, and I've lost some weight. It's like my body is betraying me. Also, I've had this cough that just won't go away. It's been weeks and nothing seems to help. A few weeks ago, I had a moment of unprotected intimacy. I'm really scared. I can't shake off the guilt and fear.
Dr. Smith, a beacon of composure and empathy, gently leaned forward. His calm demeanor was a stark contrast to John's turmoil. He listened attentively, his gaze unwavering, offering John a safe space to voice his deepest fears and anxieties. The room felt a little less cold, a little more human.
John, it's important not to jump to conclusions. We need to approach this step by step. These symptoms could be related to a number of things. Stress, a common cold, or even just a change in your routine. Let's talk about HIV, understand how it spreads, and then we'll discuss what steps we need to take. Knowledge is power, and together we'll navigate this. HIV, or the human immunodeficiency virus, is a complex virus. It attacks the body's immune system, making it harder to fight off infections. HIV is transmitted through specific bodily fluids. These include blood, semen, vaginal fluids, and breast milk.
Dr. Smith explained, picking up a model of the virus from his desk, illustrating the virus's structure.
Casual contact, like shaking hands or sharing utensils, poses no risk of transmission. The most common ways HIV spreads are through unprotected sex with an infected person, sharing needles or syringes, and from mother to child during pregnancy, childbirth, or breastfeeding. It's crucial to remember that HIV is not spread through casual contact like hugging, kissing, or sharing food.
He reassured John that his everyday interactions posed no threat of contracting the virus.
As I mentioned earlier, John, HIV attacks the body's immune system. This is a critical aspect to understand because the immune system is our body's defense mechanism against various infections and diseases. Specifically, it targets a type of white blood cell called CD4 cells, which are crucial for fighting off infections. These cells play a vital role in maintaining the body's ability to ward off illnesses. Over time, HIV destroys these CD4 cells, weakening the immune system and making the body susceptible to a wide range of infections and diseases. This gradual destruction is what makes HIV so dangerous.
Dr. Smith leaned back in his chair, his expression serious. He knew the gravity of the situation and wanted to ensure John fully understood the implications.
This progressive weakening of the immune system is what ultimately leads to AIDS, the most advanced stage of HIV infection. AIDS is characterized by a severely compromised immune system, making the body vulnerable to opportunistic infections. It's important to understand that not everyone infected with HIV will develop AIDS. Many people live with HIV for years without progressing to AIDS, thanks to modern treatments. With early diagnosis and proper treatment, people with HIV can live long and healthy lives. Antiretroviral therapy, ART, has been a game changer, allowing individuals to manage the virus effectively. The key takeaway here, John, is that HIV is a manageable condition, especially with the advancements in modern medicine. Regular checkups and adherence to treatment can significantly improve quality of life.
He reassured John that a diagnosis, while life-changing, was not a death sentence. With the right medical care and support, people with HIV can lead fulfilling lives.
Now let's talk about the symptoms you mentioned. It's crucial to understand that recognizing the symptoms of HIV can be challenging because they can vary greatly from person to person. It's important to note that not everyone experiences the same symptoms, and the severity and type of symptoms can differ widely. Some individuals may not show any signs at all for years, which is why regular testing is so important. However, some common early symptoms include fever, which is often one of the first signs. Chills and night sweats are also frequent early indicators that something might be wrong. Muscle aches, sore throat, and swollen lymph nodes are other symptoms that can appear early on.
Dr. Smith turned his attention back to John's concerns, understanding the anxiety that comes with these symptoms.
These symptoms often mimic those of the flu, making it difficult to diagnose HIV based on symptoms alone. This similarity can lead to misdiagnosis or delayed diagnosis. As the infection progresses, other symptoms may develop, such as persistent fatigue, which can be debilitating. Unexplained weight loss is another red flag, as well as skin rashes that may appear suddenly. Recurrent yeast infections and prolonged diarrhea are also common as the immune system becomes more compromised. It's crucial to seek medical attention if any of these symptoms persist or worsen. Early consultation with a healthcare provider can make a significant difference. Remember, John, these symptoms can be caused by a variety of factors, not just HIV. Therefore, it's essential to consider all possibilities and not jump to conclusions. It's crucial to get tested to determine the underlying cause. A simple blood test can provide the answers you need and help guide the next steps in your healthcare journey. Early detection is key to effective management of HIV. The sooner you know your status, the sooner you can begin treatment if necessary.
He emphasized the importance of seeking medical attention and early detection for effective management of HIV. By staying informed and proactive, you can take control of your health and well-being.
Section 5. Beyond the surface, potential complications of HIV. Left untreated, HIV can lead to serious health complications. As the virus weakens the immune system, the body becomes vulnerable to opportunistic infections. These opportunistic infections are caused by organisms that usually don't cause illness in people with healthy immune systems. Examples include pneumonia, tuberculosis, fungal infections, and certain types of cancer. In addition to opportunistic infections, HIV can also lead to other health problems like heart disease, kidney disease, bone loss, and neurological disorders. These complications could significantly impact an individual's quality of life. The good news is, with early diagnosis and consistent treatment, the risk of developing these complications can be significantly reduced. Modern medicine offers effective tools to manage HIV and prevent its progression. John, I want to assure you that while there's no cure for HIV yet, there are highly effective treatments available. Antiretroviral therapy, or ART, has revolutionized the way we manage HIV. ART consists of a combination of medications that work by suppressing the replication of the virus in the body. This helps to protect the immune system, prevent the progression to AIDS, and reduce the risk of transmitting the virus to others. With consistent adherence to ART, people with HIV can live long and healthy lives with a near normal life expectancy. Early initiation of treatment is crucial for achieving the best possible outcomes. It's important to remember that ART is a lifelong commitment. However, advancements in medication have made it more convenient and manageable than ever before. Support systems are in place to help individuals navigate the challenges of living with HIV. Now let's talk about prevention, John. The most effective way to prevent HIV transmission is to practice safe sex by consistently using condoms. In addition to condoms, other preventive measures include pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. PrEP is a daily medication that can significantly reduce the risk of contracting HIV, while PEP is a short-course medication taken after a potential exposure to the virus. Early detection is also crucial. I highly recommend getting tested for HIV regularly, especially if you engage in any behaviors that could put you at risk. HIV testing is confidential and readily available. Remember, John, knowledge is power. By understanding HIV transmission, prevention methods, and the importance of early detection, you can take control of your health and well-being. John, I understand that a potential HIV diagnosis can be overwhelming. It's important to remember that you're not alone, and there are resources available to support you every step of the way. Living with HIV is a journey that requires courage, resilience, and a strong support system. Support groups, mental health professionals, and community organizations can provide invaluable guidance, education, and emotional support. It's also crucial to prioritize your mental and emotional well-being. HIV can bring about feelings of fear, anxiety, and stigma. Seeking professional help can equip you with coping mechanisms and strategies to navigate these challenges. Remember, John, you are not defined by your HIV status. With the right support and medical care, you can live a full and meaningful life.